If your nagging shoulder pain is due to a rotator cuff tear, you know that pain can range from anywhere from annoying to excruciating, depending on how you're trying to move your arm. So what do you do about it? Orthopedic surgeon Dr. Miguel Ramirez, I apologize because I called you David going into that commercial break, is here with some insights. Welcome back.
Well, thanks for having me.
I suppose we should start with a definition because the rotator cuff is so misunderstood. What is it?
Well, the rotator cuff is a group of 4 muscles. It starts here in your scapula, attaches in the humerus, and what it does is it allows you, gives you the strength to raise your arm over your head and rotate your arm as well. So that is the purpose of it.
And how do we tear it?
It varies, so depending on your age. So in younger patients, it's usually a traumatic injury, either from a sporting event or a motor vehicle accident. As you get older and the rotator cuff is less strong, then you see more degenerative tears, where they just tear over age or overuse and things like that.
So how do we know if it's actually torn? Let's say I'm sleeping on a pillow that's too big for me or something, or I'm an avid golfer, and how do we know the difference between a nagging pain? What are some of the signs and symptoms of an actual tear?
There are hallmarks of rotator cuff tears, usually pain at night. That is one of the warning signs. Most people have difficulty sleeping, especially when they roll over on that side. They have that pain. The biggest telltale sign is weakness, okay? So when you have tendinitis or other concerns, usually you don't develop weakness in your shoulder. As a result, when you have a rotator cuff tear, however, you find it difficult raising your arm over your head, getting the strength. So most people may notice that at the gym, that they say, I can no longer lift, you know, that 10-pound weight, and it's very painful. That's usually the most concerning sign, is when you start losing strength. And
what should we do about a rotator cuff tear? What are the options for treatment?
So the options for treatment depend a lot on age and the activity level and the size of the tear. In younger patients, our studies have told us that the tears progress over time. So when we see a younger patient, usually in their 40s, 50s, that has a rotator cuff tear, we're relatively aggressive at treating it, usually with an arthroscopic surgery. As we age, we actually know that patients over 60, in some studies have shown over 50% of them have a rotator cuff tear in the shoulder. They don't even know about it. So once you get to your 60s and 70s, many times, especially if it's a small tear, we can start with conservative measures like a corticosteroid injection and then some physical therapy before we jump into a surgical option.
So it sounds like it really depends on how much you're going to be using that shoulder. If you're younger and you're still wanting to play sports and that sort of thing, you should probably get it taken care of.
Absolutely.
But if you're older, you could just do some corticosteroid treatment and maybe still have a great quality of life without the surgery.
Exactly.
Awesome. Have you ever had one?
I have not. I had a labral tear, but not a rotator cuff tear.
And which, you said there were 4. Which one tears most commonly? Or?
Most common is the supraspinatus and infraspinatus. These are the top 2 rotator cuff muscles. Those are the most common that tear.
And how would you know that those are actually torn? So which movement of the arm would indicate, yep, that's the one?
Well, the test we use in the office is what we call the empty beer can sign. So basically, we turn the hand in this direction. We ask the patient to raise their arm against resistance, and we usually see that weakness with that test. So you notice that loss of strength, especially when you're at the gym and you're trying to get something on the top shelf, especially with this arm in this direction, you will notice loss of strength.
Fantastic. And
that's kind of the most sensitive test for that.
And as a trainer, I'm going to say not beer can, I'm going to say soda can. Dr. Miguel Ramirez, thanks so much for being with us. Let's give people a quick look at how they can get in touch with you if they think they might have a rotator cuff tear and want to get a doctor's examination further. Information is going to pop up on your screen here. There's how you can reach Dr. Ramirez at peoriashoulder.com or 676-5546. Thank you so much for being with us.
Well, thanks for having me.